Thanks, Mr President. My question is to the Minister representing the Minister for Health, Senator Nash. Mental health touches us all in some way and it goes to the heart of our nation's well-being. Today's mental health announcement doesn't provide any new funding to mental health, and so it's unclear whether some people will be left worse off or if some services will be faced with more uncertainty. Will the government commit to increase funding to mental health in order to close the gap between Australia's mental health burden and the current levels of funding committed?
The Minister for Rural Health, representing the Minister for Health, Senator Nash.
Thank you very much, Mr President, and I'm sure that people around the country were very pleased to see today the announcement from the government, which has outlined a different approach to how we are going to deliver mental health care across this country. Now, in addressing the Senator's question about funding, it seems extraordinary that the Senator would go to the issue that funding is going to be the only thing that is going to solve these problems and to give us a new approach to mental health care. But that's not surprising coming from the Greens, because you just see a simplistic approach about asking for more money. What we need, Mr President, is a new approach to how we are going to deliver mental health care in this country, and that's exactly what the coalition government has delivered today. It's about efficiently and effectively using the funding that is available in what is a very, very tight fiscal environment so we can get better outcomes. This is a program that is going. This is a policy that is going to deliver much better outcomes. We are going to move from the current situation that we've got, where we see the delivering of programs from Canberra out across the community, a very centralised approach, a very siloed approach to how those programs are delivered. We are going to move—
Order, Minister. Senator Rice, point of order.
Point of order, Mr President. My question was very clear. Will the government commit to increase funding for mental health services?
Order. Thank you, Senator Rice. I will remind the Minister of the question. The Minister has 32 seconds in which to answer. Minister.
Thank you very much, Mr President. I was very clear that saying more money isn't going to give us a better approach and solve the problems. That's why the government's been very clear to say we are changing the way we are doing this. We are not looking to more money to solve the problem. We know it's a clear change to the current system that is going to work, and that means we have focused on local delivery. We are going to allow a stepped care approach. We are not going to continue in the same constrained environment that we currently are delivering mental health.
Thank you, Minister. Senator Rice, supplementary question.
Thank you, Mr President. I'll take that answer as a no, then. Mental health and well-being is affected by a range of factors, including stable work conditions, adequate housing and strong social supports. Will the government reverse its cuts to social services and stop its attacks on workplace conditions so that more Australians don't have their mental health put at risk?
Order on my right. Minister. Senator Canavan, a point of order.
Mr President, can I raise a point of order on that question, in line with Senator Wong's point of order yesterday and your timely newsletter for us? I do question its compliance with Standing Order 73. It seems to be introducing very new information beyond the original question, which was about mental health funding, now going to social services funding, and I'm not even sure if that's actually in the minister's portfolio area as well, Mr President.
Yeah, thank you, Senator Canavan. In relation to the aspect that my order on my left, in relation to the aspect about whether it's in the minister's portfolio or not, I'll allow the minister to determine that. But in relation to the primary question, the supplementary, I believe the supplementary is in order. So Senator Rice's question will stand. Minister.
Thank you very much, Mr President. In terms of the specifics, indeed I would imagine that is not my portfolio area in relation to health. But in addressing the Senator's question, Mr President, what we have announced today with this new package will do exactly what I think the Senator is referring to, and that is assisting people on an individual basis to work with them to ensure that their needs are met, that we look across different communities, that we look across different sectors, and that our primary health health networks will now have the ability at a local level to look across their regions and assess those levels of need that are out there in those communities. So people in the workplaces that the Senator is referring to will be able to be assessed for their level of need and what is going to be the most appropriate way of delivering services to those people, which is very different to the very constrained, siloed program delivery outcomes we have at the moment.
Thank you, Minister. Senator Rice, a final supplementary question.
Thanks, Mr President. All of the changed programs and funding shuffling in the world can't reduce the stigma associated with mental health. What does the minister say to Australians living with the stigma of mental health, which today's announcement does little to address?
Minister.
Thank you, Mr President, and I'm pleased to see that over recent years we are making some inroads in reducing that stigma. We are taking this issue out from under the carpet, and I think it's very important to look at those who are supporting what the government has done today, Senator, that the Mental Health Australia today has welcomed the Australian government's response, saying reform starts today. We are particularly heartened to see the government adopting a stepped care approach to mental health. The Australian Healthcare and Hospitals Association has been supportive, saying it signals a positive move. We support the important role assigned to primary health networks. We have seen today, Mr President, Beyond Blue, saying that today's announcement by the Turnbull government is a defining moment for mental health care in Australia, and that he commends the Health Minister, Susan Lee, for having the courage—
Senator Rice, a point of order.
Mr President. My question was specifically about what the minister would say to Australians living with the stigma of mental health, so specifically about stigma.
Senator Rice, the minister did address stigma and first up in her answer, and I've been listening to her answer. I think she's been directly relevant. Minister.
Thank you very much, Mr President. And I would say with the support of these types of organisations, we will be doing exactly what the Senator asked and addressing that stigma through better delivery of these programs to mental health.